We're still going to coordinate codes. We're still going to make sure we're switching CPR. We're still going to use the pit crew approach. We're not going to terminate after 20 minutes. Brent Myers has shown, particularly if the patient's end-tidal CO2 is greater than 30, we should continue that code. I was on a code in a city that will go nameless. They got a patient back with ROSC. He went out again. He came back again. They're working him. The ER said, well, we have to decide whether we're going to continue him. Could we borrow your CO2? The emergency department did not have end-tidal CO2 in the emergency department because they're always neglected. So one of the things that the Eagles is doing is pushing medicine right to the emergency department. They used to call the Houston Fire Department to bring the EZ-IO to an emergency department in downtown Houston because they didn't have EZ-IO. They used to call Phoenix to come in with their CPAP because they didn't have CPAP in the emergency department. You see how we're changing medicine? We're driving it from the streets into the emergency department. And if you're not paying attention to this, you really have to. You and I work under pressure regulation all the time. When we're stressed and our blood pressure changes, what do we get? A headache. That's pressure. When we gotta pee, our bladder fills up and there's a sensor that tells us, pressure-wise, you gotta pee. More importantly, pressure pushes the pee out, right? All these things are internal body pressures. And I said it last night, I wish that every time something was wrong, like if Ryan had an ear infection, that green smoke would come out of his ear. So then I could say to somebody, see, he has an ear infection. If you can't see it, people are not paying attention to it. But there are people that are doing it. Dr. Buzniak, Dr. Lurie, they're all looking at this. Sorry, don't mean to be so rude. Oh, I can't speak to Donald Trump right now. Oh yeah, you're right. Okay, so here's AJ's simplified understanding. When you get up in the morning and you turn the faucet on in your shower to adjust the heat, the full pressure is coming out there. When you touch the knob and you transfer pressure to the shower, you take away pressure from here and you send it somewhere else in the body. That's exactly what we're talking about here. We know now definitively that if we can increase intrathoracic pressure, we can perfuse the heart better. We also know that if we perfuse so much blood that we increase intracranial pressure is a bad thing. But what do you think they found in an elevator in South Korea? American doctors, Brent Myers and others were there, and they discovered that when they put their patients in their antiquated elevators, they had more return of spontaneous circulation. So Dr. Lurie went to his lab in Minneapolis, and we stood there with the pigs and watched, and as they elevated a normal pig without anything going wrong, his intracranial pressure dropped. And then they put him down and they put him into VFib. And we stood there for 20 minutes doing nothing. Oh my God, AJ, 46 minutes, you have brain death. No, you don't. That's a fallacy. The reality is the lungs and everything and the blood are still oxygenated. If we can get some of that blood to the brain, we can put them on suspended animation, and we'll do a couple things. You start the compressions, you put on a mechanical device, you take away all of the errors in that, you increase the pressure by putting an impedance threshold device on, where air goes in, but it's restricted on the way out. And the new Buzniak system that's going to be revealed in early January 17, uses an endotracheal tube with pressure inside, so that we're putting pressure inside the body, we're causing the heart to fill better. But what about the intracranial pressure? By elevating the pig, they found at 30 degrees that the intracranial pressure drops and cardiac perfusion increases. So what are the stretcher manufacturers looking at behind the scenes right now? How am I going to keep my autopulse and my Lucas functioning at 30 degrees? Because we're going to be doing 30-degree tilt CPR. And who's going to talk about it? Somebody will talk about it at EMS today. It's coming. Okay, this looks awkward. It's very hard work, but it works. This is Zoll's AC/DC pump. What it does is it increases the CPR pressure, and when you pull it up, the suction pulls up and increases intracranial pressure. And it's harder work, but eventually they'll push it over into a mechanical device. But they're already finding that this works out very well, and the numbers are going to be shown at EMS today. The rescue pod I talked about increases intrathoracic pressure. We had doctors literally say to me, AJ, that's $100, $40, whatever it is. It's a non-replaceable cost from Medicare, so we're not carrying it. Oh, okay, so your mother's going to die for $40. Get it? And the second thing is, it's just an expensive timing light to tell you when to put ventilations in. No, it's a metronome, it's a timing light, but the valve, which you can't see, if a puff of green smoke came out every time there's increased intrathoracic pressure, we'd all buy it. So that's how I'm going to make my money, folks. I'm putting that green dye in everything. This is what they're coming out with in France. Next week, they're going to start trialing it on the street. Dr. Buzniak, who developed some really fancy CPAP stuff, has the B card, the Buzniak cardiac arrest resuscitation device. You'll intubate the patient, you'll hook a tube up, you'll cause pressure changes in the body. It's like reaching down through that person's trachea and doing compressions on their heart, because the bulb and the pressure that's coming out of that system is going to do it. So we'll see. Will they be at EMS today? You bet they'll be at EMS today as a part of international focus. Mechanical CPR I'm not going to spend a lot of time on. You know, we've talked about that. There's still some naysayers, but all you got to do is go to Dr. Lurie's lab or go anywhere else where they have these devices. The auto pulse becoming more popular. Probably, I've been preaching to them to kind of make some revisions to it. But the reality is you cannot do, a 100-pound nurse cannot do CPR on this chubby body successfully. Can't do it. You can't fill that heart. I'll show you a cardiac arrest in a second. When I watch that machine do CPR, there is no way anybody can mimic that. This is a cardiac arrest on a loading platform in Jersey City, New Jersey. It's a complicated code. The guy is obviously overweight. There's no way they're not going to interrupt CPR, but they put a Lucas device on him. From the time they put that Lucas device on, there was zero interruption in his compressions, and they were able to get some ROSC. He did not ultimately survive, but they got ROSC where you wouldn't normally think they would. So just imagine the interruptions in CPR as I show you the sequence. You cannot do this with manual CPR. And we got in the ambulance, and everything ran much smoother, but look how far down that plunger pushes on his chest. You watch normal CPR, it don't happen like that. Because there is an inherent problem with firefighters and others thinking that they're going to break ribs. The machine doesn't do it, but the machine doesn't worry about those things. This is a well-run, this isn't staged, this is a real code in action. And that will get you, every time that thing was pushing down, they could feel a pulse in his carotid. You cannot do that with manual CPR. I have people who just can't even tell that. And what was better yet is we got in the emergency department and the hospital was using mechanical CPR. This is huge because your products will begin to be used in the emergency department because EMS is using them. Same with CPAP, same with EZ-IO, same with MAD device. Look at how calm that is. People in here who've been field providers, you don't see a calm cardiac arrest. The nurse on the left, the doctor said it's 10 minutes. Push more meds, it's 5 minutes. They didn't worry about CPR. They didn't worry about the airway. He was on a vent. He was on mechanical CPR.